Hi everyone, welcome back to the Navigant Credit Union Broadcast Center. I'm GoLocal News editor Kate Nagel. Thanks for joining us for the 4 o'clock News and Politics Hour. We got a lot of politics from Jennifer Lawless at the University of Virginia. We're going to talk some news here in Rhode Island with Dr. Sam Zwetchkenbaum, the state dentist with the Rhode Island Department of Health. Thanks for coming back.
Hey, great to see you again, Kate.
Well, I appreciate your coming in on an important topic, one that you really want to bring to the attention of Rhode Islanders. As we are looking at the opioid epidemic and looking to address that here, you want to talk about the role of opioids in dentistry and how the Department of Health is looking at working with dentists, looking with Rhode Islanders at addressing opioid usage and how to best manage pain moving forward.
Exactly. Now, I don't know if I ever told you this, but about 30 years ago, I was a dentist at Capitol Hill Health Center, less than a mile and a half from here. And I will tell you, it was an area with significant dental need, but back in the day, if somebody needed a tooth extracted, it was automatic. You'd give them the gauze, you'd give them a prescription for antibiotics, you'd give them a prescription for opioids, and we know now that that may not have been in the patient's best interest. Maybe the gauze. We know now that antibiotics, because of our concern about antibiotic resistance, but we also know that opioids are actually not always the best choice for pain control. We've seen a couple of really interesting articles recently. One that showed that the use of Tylenol with Motrin gives actually just as good efficacy, almost better very, very frequently.
Now, that combination, Tylenol and Motrin, is this just a chemical combination for the average layperson?
Right, good question, great question. So the ibuprofen, or is an NSAID, a non-steroidal anti-inflammatory, acts locally. It acts right at the area of inflammation.
Okay.
Then the Tylenol acts centrally, right up here. So and the opioids just act centrally. So this is helping in 2 areas, and it doesn't have the risk of abuse potential.
So talk a little bit about the role of the Department of Health in getting this information out to dentists. I don't want to put you on the spot, but I don't know how many dentists there are in Rhode Island to really have this education campaign to say, hey, let's take a step back here, look at your prescription, look at your kind of what you've been up to, and here's another approach.
Right. So I think dentists are increasingly aware. They see articles in the Journal of the American Dental Association. We have educational events. But the other thing we want to do to help dentists is help them communicate effectively with patients. Many patients are coming into the dental office and they're expecting to get that opioid prescription, and when their dentist doesn't give it to them, the patient's like, hey, is there something wrong with me? No, the dentist knows they're actually doing better. So I brought this sheet along that I'm going to show you.
Okay.
This is based on a dentist by the name of Sarah Phillips. Dr. Sarah Phillips.
Local or national?
She was local. She was doing her 3 years stint with the National Health Service Corps in Newport at East Bay Community Action. She's originally from Texas. Unfortunately, she's left. She was wonderful. She showed me this sheet, and I'm going to have to explain it to the viewers. But what it does, it makes getting that combination of Tylenol and ibuprofen almost like a prescription, because it says, okay, take these tablets at this time, take these tablets at this time.
Oh, so this is very specific.
It's very specific.
They just don't send you home and said, take your Tylenol and Motrin together whenever you need it, but here's how the time release that you'll need.
Exactly. So we've posted this on our website, and we also had it in the Rhode Island Dental Association Journal so that dentists know to use this. And again, I'm really happy that you let me come on today, because I want patients out there, or people, or Rhode Islanders to know that if your dentist gives this to you, this shows they care.
Let's talk a little bit, anyone who's been to an emergency room in recent times, or even a dentist, any office where they ask on that pain scale. And if they say, how much pain are you in? One's a very little pain. Hopefully I'm not mixing up the levels, and 10 is excruciating.
Yeah.
Is there a point in time where a dentist might think, well, okay, there seems to be acute pain, I'm going to prescribe an opioid, or is this supposed to be the panacea for everything?
That's a great question. We do know that there are times that the dentist will assess the situation and realize that maybe this patient would benefit from an opioid, but I think they're going to give fewer now.
Okay.
Again, going back to my own history, now I'll tell you as a 16-year-old, I remember I had my wisdom teeth out, and the oral surgeon gave me a very large vial. How many did I take? 1 or 2, right?
But you had a large vial.
What did I do with the rest? I put them on a shelf. Now, I could have done probably not great things with this. So anyway, so the other thing I wanted to share is that there was a recent paper in the Journal of the American Medical Association, and they followed insurance data on 19,000 people, 16 to 25-year-olds who had received a opioid prescription from a dental office.
Okay.
And they paired them with controls, 19,000 who had not.
Okay.
They followed both populations for 1 year, and they found that the group who had received the opioid prescription, over 5% of them had had a physician visit for an opioid abuse-related disorder. So that tells us that 1 out of 20 are going on to have a potential problem. In the control group, it was less than 1%. So that was significant. So that's why it's really important to get this message out.
So I might take you out of your dentistry comfort zone for a second and ask you, and it might not be your jurisdiction, but if Tylenol and Motrin can help in the dental industry, can it be applicable to any other health areas as well?
Certainly, certainly. I think I've heard of cases of it being used in the emergency room when people are sewn up after an injury. I think that's where the physician or dentist is going to have to, give the patient that information, help them make that decision. If they do prescribe, maybe smaller amounts. But yeah, I think increasingly I know for me, if I've had problems, I've used that combination and it works. So.
Now, do you ever hear from dentists? Of course, they're oftentimes on the receiving end of those pharma reps who come on in and tell them that the drugs that they have, with all of this awareness of opioid and opioid abuse, we've also had on the flip side, we've had the folks who say, don't punish the pain for those who use opioids effectively. But do you think it's changed the dentist office from those folks who come in and say, here we have some opioids that might help your practice a little bit?
Yeah, I think patients are aware they're not expecting the opioids as frequently from the dental office. I think the patients also, again, the ones who maybe are looking for opioids, I think they're aware that the dentists check the PDMP, which is the monitoring program, and they look for potential concerns. So I think the information is out there. One thing, you mentioned emergency rooms. I can say that there are a significant number of people who present to the emergency rooms with dental pain. That number has actually gone down a little bit, which is great news, and we suspect that's because people know that emergency rooms are giving out opioids less and less.
Well, anything else you want to share while we have you here in the studio? Again, I appreciate this unique vantage point of the dentist vantage point of opioid use and how to address it. Anything else you want to share with folks?
Well, I guess I will say with the holidays here, I know people are going to get a lot of cookies, candies, and sweets. I'm going to confess that as a dentist, I do eat cookies, candies, and sweets, but I do brush and floss after. And I think it's also the amount of times, the amount of interactions with those sweets. If you limit it to just having it maybe once a day and not exposed all the day long, that's probably better for your teeth.
Is sugar really the biggest culprit with enamel destruction and wear?
Well, it's the bacteria. The bacteria consumes the sugars, converts it into acids. So it's the combination of the sugars with the bacteria.
Can you really explain that well to kids during the season too? Like, put that candy cane down just once a day.
I think they want the candy cane. So.
They might want the candy cane. But I really appreciate your taking the time to come in. We follow, obviously, opioid use and the state's role in combating it here. I appreciate your taking the time. Dr. Zam Zwetchkenbaum, thank you so much.
Good to see you again.
And we're going to wrap up here in the Navigant Credit Union Broadcast Center because we're going to be heading over to the City Plan Commission where they are taking up a proposal to tear down a historic property on Blackstone Boulevard and subdivide it into 10 houses. So be sure to catch us when we pop back up with GoLocal Live at the City Plan Commission, probably around 5 o'clock. But of course, come back tomorrow here in the Navigant Credit Union Broadcast Center for Laura Afonso and all things food and drink at 3, and I'll be back with news and politics at 4. Catch us on GoLocalProv.com. See us on Facebook tonight, and we look forward to seeing you